Hey class, my name is Zachary Silberman. I go by Zach. I work in Durham County, North Carolina at Duke Regional Hospital. I work on the vascular access team, so we're in charge of placing PICC lines, midlines, ultrasound guided IVs, and answering any kind of miscellaneous questions / helping solve any problems in regards to venous access. So anything peripheral IVs or central venous access catheters, we're kind of in charge of helping manage. So if a patient, has an occluded line, we might be the ones instilling TPA or deciding whether a catheter should be removed or not. Kind of in cohort with the ID docs or the primary care doctors in regards to whether this line is suitable or not. As far as a nurse who inspires me, I really look up to my wife. She is the one who kind of inspired me to become a nurse in the first place. I was in my early 20s. She was already a nurse at the time and kind of guided me in that direction just because I was a little aimless at the time. I'm now 31. And one thing that really I admire about her is she's a very skilled and intelligent nurse. She is incredible in the hospital, but then when she comes home, she's really good at leaving work at work, where I'm definitely someone that takes a lot of work home with me, unfortunately. I can get kind of stressed or hung up on things. I just admire that she just, no matter how hard her day was at work, she's always her normal self at home and doesn't really like to talk about work at home. So I appreciate her boundaries, and I aspire to do the same. In regards to my clinical experience that I have with community health, I don't have a ton. I did clinicals in school for one day at a place called Lincoln Community Health Center, where I worked with a nurse she was bilingual, which was excellent, and she helped provide vaccines and general health information for predominantly immigrant population, which was awesome. I mean, it's great to see like that kind of outreach. I look forward to being on the side of prevention. I think that community health tends to err that way, where hospitals just kind of by definition are more on the treatment side. So I get a lot of the treatment side of things, but I don't really get to see the prevention side of our healthcare system. So I look forward to this class in regards to that. Kind of along the same lines, in regards to something about a public health topic that just reading through the book that I look forward to learning more about is risk communication. Kind of along the same lines, I just think it's an awesome skill and perhaps something that's undervalued in our healthcare system is kind of reaching out to at-risk communities and figuring out ways to communicate it appropriately. I mean, we were able to do it with smoking, and now unfortunately we're in the obesity epidemic, and sugar is a real thing. I hope that we can figure out a way to, have an honest dialogue about what we're eating and the way that we're consuming things in regards to our general health, because metabolic diseases are a huge burden on the healthcare system, and it pulls from our tax dollars. It pulls from, health equity, like looking at, lower class versus upper class and the health differences there, as well as like the environment. I mean, the way that we eat affects the environment, and I think moving towards a more healthy outreach or outlook, we can really do some awesome things for our country. So anyways, I think risk communication is a really interesting topic, and I look forward to that, and I look forward to working with all of my peers. Awesome. Bye, guys.